this talk. You can have a chance after the end of the second session. So now move on to second talk. The speaker of the second talk is Mr. Jorge Mateo from WHO, who is a team leader of WHO. And he will talk about the new revision of the WHO medically important antimicrobial list 2023. Yeah, let's welcome Mr. Jorge Mateo.
Thank you. Good afternoon. Thank you for the invitation to this conference. I'm happy to be here. And also, thank you for this opportunity to share this new revision of this tool. That is, I bring this tool to share with you because it's related with the work on Codex and it's close link with this. And I will take some time to explain what is the changes in the new revision. And the first, I will start with this one because you know now the new name is the Medical Important Antimicrobial List. Previously, it was called as a Critical Important Antimicrobial List. But that was in some ways some confusion for the readers because critical important is already a category of the list. So we also consider that it's more appropriate, this new name, the WHO Medical Important Antimicrobial List. So in this presentation, I will share some context and background about this list, the linkages with the Codex text, the purpose and target audience, the classification in these new changes that we did, the methodology for the categorization and the uses and implementation activities for the list. So first, I would like to mention the WHO bacterial priority pathogen list. And you see that the foodborne pathogens and commensal, most of them are considered as a high priority, and we have the commensal considered as a critical priority. Also, it's important to we know that the use of antimicrobials in different sectors, but we have antimicrobials in the same class with the same action and, of course, the same resistant mechanism. So we have this just an example. Quinolones, we have ciprofloxacin that is used in the human health, and we have enrofloxacin that is used in the animal health, but both are quinolones and they share the same resistant mechanism. So it's important to mention because sometimes because the name is different, we consider that it's not the same. And what is the background? Already Marcus explained and mentioned, also Professor Park mentioned this meeting in 2003, 20 years ago. So 20 years ago, in this meeting, this tripartite meeting was mentioned and recommended to WHO to create, to establish an expert group to develop this critical important antimicrobial list. Because already we had clear evidence of adverse human health consequences due to the resistant organism resulting from non-human usage of antimicrobials, the amount and patterns of this usage, and the consequences for human health. So we can see from this figure on the right side that we have already these three groups: the antimicrobial use in the human health, antimicrobial use in both in humans and animals, and antimicrobials that are only used in animals. This tool, the MIA list, is addressing the objective 4 of the Global Action Plan on AMR, optimizing the use of antimicrobial medicines in both human and animal health. It's a long journey. It's 18 years already. And for the colleague, I agree with Marcos. It's a long history. But you know, we can see now that in 2005 was the first version of this critical important antimicrobial list. But the Global Action Plan was only launched in 2015. So it's a long, long way. But of course, we are now, I think that finally AMR is in the priorities in countries at global level. So it's important, it's a good moment for AMR to be addressed. I agree also that awareness is important, and build systems takes time. And that is important because we can see, and Professor Park mentioned some of the work that has been done in Republic of Korea from 2015 to now. So it's a lot of work that has happened, but it's a long journey as well for countries to build this system. And the problem, I think, just to comment, is that bacterial infections has not been prioritized because antimicrobials. So now we have the problem of AMR, so we need to address that because we have these multi-drug resistant infections. So from this, I can also mention the first changes that we did in the new revision. In the previous one, we have only 3 categories. The critical important, in this category, we also have the highest priority group of antimicrobials, the highly important, and important. So now we also have 3 different groups that I will explain later. What is the linkages with of this MIA with the codex? So it's part of the principle 3 and the guidelines for risk analysis of foodborne AMR. That is a codex text from 2011. About the foodborne AMR risk analysis, should consider relevant international documents, and this CIA list is mentioned. And the code of practice to minimize and contain foodborne AMR is also mentioned when setting priorities and identifying risk management measures should take into account this list. The principle 4, principle 14, that is also bringing the different tools that exist from the different organizations. And the principle 14 and this code of practice also mention the importance to consider the highest priority critical important antimicrobials that are in this MIA list. The assessment, to consider for the assessment of potential antimicrobial agents to select for resistant microorganisms, and for training on foodborne resistant and responsible and prudent use of antimicrobials. This is the framework for foodborne AMR risk analysis, and where the WHO MIA is more related. Also now in the new Codex Guidelines for Integrated Surveillance that was also mentioned, I would like to thank the Republic of Korea to support the establishment of the new quadripartite technical group on integrated surveillance that is considered in the Codex text. And now the idea is to have this quadripartite guidance. This is a global effort to go on the same line, the 4 organizations. So thank you for the support and for funding this establishment of this technical group. So what is the purpose and target audience of this MIA? Basically, the purpose is to ensure that all antimicrobials, especially MIA, are prudently used both in human health and veterinary medicine. And also to help regulators and stakeholders know which type of antimicrobials used in animals present potential high risk to human population. And the target audience, national regulators and policymakers in both Ministry of Health and Ministry of Agriculture, all prescribers, veterinarians, veterinary paraprofessionals, aquatic animal, and also physicians. National AMR steering or coordinating committees that already exist, and this is a good group to target because they are in charge to implement the national action plan in each of the countries. So this is one of the target audience. And finally, food animal producers, including institutional food purchasers, food companies, etc. So just move to the analysis and consideration for this new revision. So all classes of antimicrobials were analyzed using both animals and humans, using 2 criteria. This is, there's no changes in these 2 criteria. Now we introduce these groups. Antimicrobial groups were evaluated based on their current authorization status in human, both in human and animals, and only in animals. As I mentioned at the beginning, the categorization is based on the resistant mechanism. And the most common, because we know the most common resistant mechanism affect all the agents in a particular class of antimicrobials, with some exemptions, for example, the first and second generation cephalosporins, because beta-lactamases, their resistant mechanism are different, comparing with the third and fourth and fifth generation cephalosporins. Or the presence of different resistant mechanisms compared to other members within the class or subclass. It's the case of plizomycin and aminoglucosides. So I mentioned the three groups. So the first one is, we have now this new group, is the classes of antimicrobials that are authorized for use in human only. Then we have the group of antimicrobials that are authorized for use in humans and animals, and the group that is authorized for use in animal only. The first two groups are considered as medically important, and this is our focus. And the third group, only authorized for use in animals, they are considered as non-medically important antimicrobials. The group of antimicrobials authorized for use in humans and animals is where we apply the criteria and prioritization factors that I will explain. But from here, this picture is just showing what is the high AMR risk. So it's important to consider that the antimicrobials only used in humans are the most critical now to treat multi-drug resistant infections. And that's why they are separated, but they are the most critical and the most important. So to explain a bit more the importance of this new group authorized only in humans, mainly the classes included in this group are new antimicrobials. And they are very important for treatment of serious multi-drug infection, and they are considered as a last resort. Should be considered by default as most critical, as I mentioned, with the highest AMR risk. That means that even we have the highest priority critical important antimicrobials, they are more critical. And the last one, they should not be authorized in the future for use in food-producing animals, crops, or plants. The classes of antimicrobials that are used in both humans and animals, we apply the two criteria. And basically, the first criteria is related with the limited available options to treat serious infections. And the second criteria is the evidence of the use to treat infections caused by bacteria, possibly transmitted from non-human sources or with resistant genes from non-human sources. So in this case, we evaluate each of the classes. If both criteria are met, they are considered as critically important. If just one of them are filled, they are considered as highly important. If none of them is fulfilled, they are considered as important. So from this, in the category considered as critically important, we also apply prioritization factors. But in the previous revision, the prioritization factor, mainly the prioritization factor, was a bit confusing for people. What is the large number of people? What is the high-risk population? So in this case, what we consider is to apply some of the WHO tools that we have. In this case, you see that in the right side, the prioritization factor 1 now consider the essential medicine list and the aware classification. I will explain later in some slides. And the prioritization factor 2 is considering the evidence on transmission of resistance from non-human sources. So in this case, if both prioritization factors are met, they are considered as the highest priority, critical important. If just one of them is, they keep the category as a critical important. I will explain quickly the WHO model list of essential medicines. This is not just for antimicrobials, in general, it's for all medicines. So, but in this case, We already have a list of antibiotics that are included in this essential medicine list. So this EML, the essential medicine list, satisfy the priority healthcare needs of a population. It's important, just it's a guide for countries to adopt or adapt this list based on the local priorities and treatment guidelines. In the last revision, 39 antibiotics were included, and they are also classified with this AWARE classification, access, watch, or reserve, that I will explain later. But at this moment, we have 39 antibiotics included there in the EML. The AWARE classification basically is to support access of antimicrobials for countries. And the access category is analyzed based on the lower resistant potential. Then we have watch, that is higher resistant potential, and the reserve antibiotics, they are the last resort option to treat multi-drug resistant infections. Access and watch are the most common first or second choice for common infection syndromes. So that's why, in this case, the prioritization factor was linked with this AWARE classification, because this classification is a systematic classification and not just a definition that the group decide. It's a full classification of all antimicrobials as access, watch, or reserve based on the different syndromes in human health, but the EML only includes 39 of this full list. Just quickly as an exercise, using fluoroquinolones, as I explained, ciprofloxacin in humans or enrofloxacin in animals, when we evaluate this, both criteria are met, so they are considered as a critically important. When we apply the prioritization factors, these fluoroquinolones are in the essential medicines and also are considered as watch or reserve in the AWARE classification. With these two conditions, they met the prioritization factor 1. And the second one, we have extensive evidence of transmission of resistant bacteria or resistant genes for this class of antimicrobials from non-human sources. So that's why fluoroquinolones are considered as the highest priority critical important antimicrobials. So just quickly to compare the last revision with this new one, the 7th revision, we keep the highest priority critical important antimicrobials, cephalosporins, 3rd and 4th generations, quinolones and fluoroquinolones, and polymyxins, colistin basically. And now we included phosphonic acid derivatives, basically it's phosphomycin. Macrolides were moved from highest priority critical important to critical important antimicrobials, and the rest of antimicrobials were moved to the only use in humans, only authorized in humans. This is the list that you, the full classification. What is the intended use of this WHO MIA list? Prioritization of risk management strategies, including in conjunction with the codex text. To be used in developing policies and guidelines to support responsible and prudent use of medically important antimicrobials in non-human sectors. To guide approaches to reduce or restrict the use of antimicrobials in non-human sectors. This is still a problem, the use of antimicrobials as growth promoters. And the inclusion of these antimicrobials in the list for monitoring and surveillance program for AMR and AMU. And communication on risk of antimicrobials in non-human sector to the public. This is the last report from the World Organization of Animal Health, where you can see that there are some countries using even highest priority critical important antimicrobials as growth promoters. And this is the big issue. We still have some countries using this most important antimicrobial for human health. What we are doing now is doing global efforts, quadripartite work. Marcus mentioned a lot of activities that we are doing jointly with the quadripartite organization. But now the next activity that we are going to conduct after the publication of this medically important antimicrobial list will be to work together with the other organizations to try to align the different tools, because this also has been a issue for many countries which list use, WHO list or the World Organization Animal Health list. So the idea is to try to align to be more clear for countries using and applying the different lists. In summary, this list is an important component of the Global Action Plan of AMR to support risk management and containment of AMR due to non-human antimicrobial use, support countries in developing policies and guidance for responsible and prudent use of antimicrobials, improve integrated AMR and AMU monitoring surveillance systems. And this last aspect, I think that is one of the challenges that we have and we need to address together, and we are doing that with the quadripartite. Multi-sectoral collaboration is key to implement action to contain AMR. This MIA should be used in the non-human sectors, but the human health sector should be working with them, with the different, to analyze and evaluate what is the use of antimicrobials and work together to contain antimicrobial resistance. It's not just the list to use for others, but it's to use together in the different sectors. So this is exactly the One Health approach. Thank you.
Okay, thank you very much. And we'll take several questions from the floor. Okay, Professor Yong Park.
Thank you very much for your wonderful presentation. May I ask in Korean, then translator will tell you in English.
I don't know whether I missed that, but for the glycopeptide, for example, like vancomycin, this is a last result for human medicine. It's no longer used in the animal medicine, but avofacin has been used as a feed additive. But according to WHO, so is it highly important or just important?
Very good question. You know, if you see, the glycopeptides were considered as a highest priority critical important, but now, and based on the evidence that we have, they are not used in animal sector, so they were moved to the group of authorized only for use in humans. So they are still critical, but we couldn't apply the criteria because they are only used in humans.
Okay, one more question from the floor.